of the most frequent misconceptions is that your genes are your destiny when it comes to diseases like type 2 diabetes. The data simply doesn't support this. While genetics absolutely play a role, the common variants we've identified so far only account for about 10 to 15% of the heritability. This tells us that the lion's share of the risk actually comes from environmental factors, and crucially, the interaction between those factors and your unique genetic background. And that window of environmental influence opens well before we're even born. According to what's known as the Barker hypothesis, metabolic conditions during pregnancy can essentially program a fetus for diseases that show up in adulthood. For example, if a mother experiences metabolic stress like high blood sugar, it can cause lasting epigenetic changes in the fetus that increase that person's long term risk for developing obesity and type 2 diabetes. All right, let's bring it all together. So, the key takeaways are these. First, precision nutrition is an integrative science. It combines genomics, microbiome data, and information from wearable sensors. Second, its goal is to shift us away from generalized guidelines and toward individualized, data driven plans. Third, this approach makes it possible to predict personal metabolic responses to food. And finally, the future of this field likely involves AI driven systems that can provide us with continuous real time feedback to guide our behavior.